is.
Well, you know what I just started doing was just this.
Yes, sir.
And I could feel that in here.
The hip flexors.
I was
okay.
I was doing that this morning.
Okay. And you're able to at least raise your leg up a little higher, somewhat.
Well,
okay.
I have nothing to measure against.
Good. Okay.
You know, I need one of those measuring things.
To measure.
Yeah.
Yeah.
It's not worth it.
We're working on Mr. Clark here, trying to get his hip flexion to increase for him. So the first thing we have you do is I'm actually gonna have you walk around, sir.
Okay.
So sorry, being a small space in here.
If I walk with the left foot inside, then I walk different.
But you are straighter though.
Oh, I feel it.
You are definitely straighter.
Yeah.
So let's have you stand right there for me. And nope, just go ahead and try to stand as straight as you can for me.
Yeah.
So before you were leaning quite a bit forward this
Yes.
direction here as you were walking. So what we've been trying to do with Mr. Clark is trying to get his hip flexors to stretch more and his extensor here to be contracted more so he can actually arch his back here, get that curvature back. And how we accomplish that is by adjusting the spine here along with doing a lot of other, therapy to try and release the hip flexors and then eventually have him strengthen these extensors to pull him back. So now he's much more erect than what he was. So, because as we get older, everything has a tendency to go forward and what we call forward flexion. So, which is what mostly everybody that fights with that after the age of 25 when you start to sit at the desk and start working, So unfortunately, as we get older, everything goes forward faster. Even when you're not working, it gets worse.
Well, like I said, I used to stand up very straight, and then I did a month working at Walmart, and I had the back brace on, and that ruined me.
Yeah.
And even my wife says, you came out of that different than when you went in.
Yeah. It's about functionality and mobility, So even though the brace helps you, in a sense, helps you to keep stable, it then limits our mobility. So hence, almost like it's locking you in one position. Well, living is about being mobile and functional. So
now I know it was stupid on my part.
Well, it's just one of those things that you have to do it before you know the difference. So let's have you go on your back first for me. With head this way, feet that way. So first thing we're going to do is we're going to bring this knee up on you right there, Mr. Clark. I'm trying to get some more flexion on you here. Good. So we're slowly bringing this up further. When we first saw Mr. Clark, this, believe it or not, is a big improvement from where he was. We were somewhere here. And even trying to get him to go up to neutral position here. This is my neutral position, but we want everything to be up further and further. Most people, we want their quadricep to be touching the abdomen. So unfortunately, with Mr. Clark, it's going to be a little tougher.
Yeah.
So, all right, so we're going to bring this all the way up. Go ahead and resist downward for me right there, Mr. Clark. And relax me. So what we're trying to do is release the hamstrings and the glutes muscles so it can stretch more for him. And let it go for me, sir. Good. Keep going. Push downward for me. And relax me, Mr. Clark. Good. Keep going. And relax me, Mr. Clark. Good job. All right, let's drop this all the way down. And when you lock your knee for me, Mr. Clark, push downward for me.
Push down.
Yes, sir. And relax me. Good. Keep going. And relax me. Once we activate the glutes and the hamstring muscle there, we're going to bring it back even further. Trying to get a little more range up there. You feel the stretch right down there, right?
Yeah.
Good, sir. Keep going. Good. Resist downward for. And nice job. Feel like one more time. And relax me, sir. Good. Bend this here. We're bringing it all the way up on you. Good. Good. Typically for us, when we adjust the hip for our patients, we adjust it using a drop table and we drive it more inferior. Thompson drop. Stay right there from your slide. Good. One more time right there for me. All right, we're going to bring this up again. All the way up, Mr. Clark. Nice and easy. Good. And nice job. The other issue we had with Mr. Clark was that because his hip flexor was so tight, we had a hard time really bringing the leg and flattening it all the way down to the ground. But he's doing better.
Right.
So on this, we had an issue with keeping him, or he had an issue with just laying on his back and the knee was bending like this. We could not straighten the knee out. So now, this is, I can't say it's normal for you, Mr. Clark, but it's better, right? It's much
Well,
more.
you can't say it's normal, but yeah.
But it's improved.
It is a lot better.
Okay,
Yeah.
good. All right, let's lock the knee and resist downward for me right there, Mr. Clark. Good. And again, all we're trying to do is stretch out the hip flexors even more. So to do that, we activate the glutes and the hamstring muscles and make them pretty much become more responsible for themselves and do the work. And relax me and straighten your leg out and push it down towards the ground for me, Mr. Clark. Perfect. Keep going. Good. So this is our way of activating, again, all the extensor muscle of the low back and of the hip and pelvis, okay? So we're gonna bring this up again, all the way up. And bend the knee for me slightly, Mr. Clark. I'm gonna bring it all the way up on you. Okay. This is his tough side right there, trying to get this into flexion here. Can you bend the knee fully for me, Mr. Clark? I'm gonna bring it up on you, nice and easy, all the way up. Good. Good, resist downward for me, Mr. Clark. And relax me, sir. Good, keep going. And relax me. Good. One more time, you can do it. And let it go, Mr. Clark. Good. Drop this on here.
I can feel it inching up when you're doing that.
Yeah, slowly coming upward on you.
Yeah.
Good, let's go up again for me. Alright, just let me bring it all the way up on you. Keep breathing for me all the way up. Now resist downward for me, please. And relax me, Mr. Clark. Keep going. And relax me. Stay right there. And relax me.